electroencephalogram or EEG, these are useful in the diagnosis of various activities or various diseases of the humans. So what is the significance of this EEG? That they are useful in the diagnosis of, or they are useful in the giving the difference between the normal electrical activities of the brain and the abnormal activities of the brain. So by viewing these graphical representations, the physician can differentiate between the normal and abnormal findings of the patient. So why this EEG is performed to diagnose various diseases? It may involve the neurological disorders, and it may also involve the sleep disorders. So the most specific, the neurological disorders, which the graphical representations of the brain activities, these abnormal graphical representation will be useful to assess different diseases that will be related to the brain or different neurological disorders. These neurological disorders include epilepsy, in which there is increased nerve impulse transmission by the cerebral cortex. The other disease would be the midbrain disorders, as the midbrain is involved in different motor nervous transmissions. So it would affect the different movement disorders. Midbrain is basically involved in these disorders would be related to the movement. These will also related to different vision disorders and hearing disorders, and some intellectual disorders will be related to the midbrain disorders. Some other diseases can also be evaluated by these graphical representations. These are the subdural hematoma. So subdural hematoma, in which there is if in case of injury, there is excessive blood accumulation in the subdural space, which is present above the cerebral cortex. Some other diseases of the brain's disorders can also be interpreted by these graphical representations, that are encephalitis, which is the inflammation of the meninges of the brain. And in some cases, the brain tumor can also be diagnosed with the help of these EEG graphical recordings. The other disorders include the most common sleep disorders can also be diagnosed by the EEG, which includes insomnia, in which there is the deprivation of sleep, hypersomnia, in which there is excessive sleep, and somnambulism. So somnambulism is the disorder of the sleep in which the patient tends to walk after the sleep or during the sleep. The other disorder is the sleep apnea syndrome, in which during the sleep there is some respiratory blockage for a temporary respiratory blockage, and then nightmare and night terror, which is related to the frightened reactions of the persons. There is necrolepsy, which is related to the sudden sleep, and cataplexy, which is related to the sudden outburst of emotions, and nocturnal enuresis, which is related to the bedwet, and certain movement disorders during sleep are also observed in some people. So EEG will be useful to diagnose and to assess such sleep disorders.